I'm extremely glad to be back in Shwe, which was first to host the Southeast Asia Breast Cancer Symposium back in 2016. And from this event, it inspired and enabled us to hold the second Southeast Asia Breast Cancer Symposium in our country, Myanmar, in 2017. I would like to continue with talking about our foundation, which is a non-profit organization and dedicated to the cancer awareness among people of Myanmar, which is the utmost importance to get earlier diagnosis for the better outcome. So what we do is mainly is the advocacy and empowering people. For example, like empowering women to do breast examination monthly, because we are LMIC country and we don't have any organized screening program, but we are helping out with to be able to access to the mammogram free of charge at times. And also we are focusing on the patient advocacy, patient engagement, and patient support as well. To achieve our objectives and the strategies, most importantly, we do health education, cancer awareness, outreach programs, pre-COVID era, and going to the hard-reach areas, giving talks on the common cancers like breast, cervical cancer, colorectal cancers, and oral cancers. And also we do helping with the on-site screening programs. For example, we do, according to the WHO, cervical cancer PI screening, and if the woman is tested to be positive, we will do cryotherapy on site for the past nearly 10 years. And for the oral screening in our country, it's common because we are beta chewers, so we can also detect the precancerous lesions. And we integrated for breast, cervix, and oral on site at the same time with the expert volunteers from our foundation. And also we integrated with the non-communicable diseases like measuring BMI, measuring blood pressure, blood sugar, and we would offer testing hepatitis B, surface antigen spot test. So that is in the pre-COVID era. But during the COVID and the post-COVID era, like in any parts of the world, we have to go virtual. So we are doing online health education and cancer awareness, talks, symposium, training of trainers, courses, etc. And we are UICC member and full member, and so we would do World Cancer Day activities since 2015 when we became a full-time member. And we achieved the World Cancer Day Spirit Award finalist in 2018 together with the Poland and Cyprus organizations. And that time the winner was Pink and Blue organization from Nigeria. And we would use the World Cancer Day themes like we can, I can, I am, and I will. And now we are ongoing activities for the Closer Care campaign from the UICC each World Cancer Days. And another thing is collaboration and cooperation is a key to success. So we are incorporating with the WHO, UICC, Global Focus on Cancer, and also with the other international partners and local partners as well. Also, we would like to do the research activities, and we would present it in the World Cancer Congresses, and has been published some of the papers in the Journal of Global Oncology as well. And so we are trying our best despite challenges and barriers. Awareness is the key to early detection, but even that awareness is the challenge, because in our country, the main challenges is the patients, the people tends to have traditional myths, and simply they don't want to hear about the cancer ward. So So if you are going to talk about the awareness only on the cancer, if you want to find out early enough cancers, they will not be happy enough. So we do this barrier by doing other NCDs like hypertension, diabetes, etc., etc. So they are willing to come forward. And then we will talk about the cancer health education as well as do some breast examination teaching, and as I mentioned, cervical cancer screening as well. And another thing is, I think we have still hard to reach areas, so the accessibility is not that strong, and the resources, the trained human resource with our own languages. We need cancer education materials. We are trying to do that. And the media, we are using the various platforms and from the TV channels through the radio. But radio is, they can reach throughout the whole country, but it's just audio. So for the digital media and the IT, most of the young people, they have smartphones. So we are reaching out from that era to overcome that. And, each and every project, you need cost and funding. So that is also the barrier. For our foundation, whichever activities you do, we have opened the everything free of charge daycare chemotherapy service for the breast cancer patients and the colorectal cancer patients. It's been now 8 years, and we've been treated 1,100 patients, everything free of charge up to now. So where's the funding come from? So it is from we Myanmar people, they are interested in philanthropy, and they would like to donate, and for whenever their birthdays or for commemoration days, or and mainly from the cancer families. We will keep the money in the bank, and then only the interest we are going to use. But surprisingly, our foundation has been founded for nearly 10 years. By December, we are going to celebrate 10th anniversary. And from the very seed money, it has been 60 times raised by now. So from the local organizations, we have, and for the fundraising, whenever we go to the community events, we will do some fundraising, something like fun fair. We are raising awareness. In other words, they would like to donate more. Like in every part of the world, in women, breast is number one, and the cervical cancer is there. For the men, lung cancer is still number one. And in our country, because of the betel, alcohol, and the tobacco, oral cancer is coming up. And also because in our country it's hepatitis B and hepatitis C, so we are seeing liver cancer patients as well. And stomach is also quite high, and as well as colorectal cancers. With the aid of the Gavi, for the 9 to 11 years girls, cervical vaccine has been put under for the school girls pre-COVID era, yes. And we have to welcome the single-dose cervical vaccine so that the expenses will be low for the out-of-pocket families. Our mission is dedicated to improve awareness among people of Myanmar. So we would like improvements in the cancer awareness programs, and we are focusing on the family-focused cancer prevention and early detection. Because in Myanmar, our Asian people, the family model is towards the extended family members, looking after the grandparents and the children and relatives. And another thing, we are focusing for the next generation young people, so that they would become the emerging volunteer leaders. So we have to create the interest of the young people to do volunteering works. Because in our foundation, we all are volunteers. We don't have any paid salary staff. So we are focusing on the family focus and young volunteers for the sustainability of our foundation. So we are doing that. So thank you so much for organizing for this interview to the ecancer and the organizing committee of the 2023 Southeast Asia Breast Cancer Symposium. And our foundation is looking forward to learn more and to do more collaboration work for the people of not only our country, for the region, and as well as we wish everyone free of cancer. And that's it. Thank you so much.